Hi, this is Vanessa. I'm going to talk to you about my Level 1 second year fieldwork at Premier Home Health. Premier Home Health is run on referrals from the doctor. They receive an order from the doctor to see the patient in the home, and the order is sent based on what the doctor feels that they need. If anybody from the team does recognize that they need somebody else for a little more help, they will contact the doctor for a referral. Premier Home Health offers occupational therapy, physical therapy, speech, nursing, and social work. The most common diagnoses that I saw on fieldwork were Alzheimer's and dementia, orthopedic, Parkinson's, and CVAs. Most, if not all, patients had comorbid diagnosis. The treatments were based on the orders from the doctor, based on what they felt we needed to work on with them, and the diagnosis that had put them in the hospital and brought them home. But you also needed to work on other deficits. And discharge is based on insurance, so the length, how many weeks they have, and if their insurance runs out, then that's when the service stops. Also, services, they discharge when the services are no longer needed. The role of OT in home health. The OTR that I was with, she did the initial evaluation, the re-evaluation, the home safety recommendations, treatments, and discharge. They currently have one CODA in Premier, but she has moved more towards a marketing position within the company. However, when she was doing treatments, her roles were home safety recommendations, treatment, and she also did discharge recommendations to the OTR. A typical day in Premier Home Health is that they would call the patient the day before and find out what time would be best for them. A lot of times, if they weren't really feeling good or if they have doctor's appointments, they would cancel or kind of move the times around. But it was really common that they saw them like twice a week, so a Monday or Wednesday or a Tuesday or Thursday. They see about 4 to 5 patients a day, and they get paid on the number of patients they see. So when they get really busy, sometimes they have to fluctuate between the OTs. They only have 2 right now in Premier. The day ends whenever you're finished with the last patient, so that made a really flexible schedule. And they did get reimbursed for mileage. My OT that I was with, she was usually done by 4 o'clock every day. Documentation, they work on documentation in between the patients, the patient visits if there's downtime, usually in their car, or they can stop at a restaurant or something, or if they're close by the office. They can take the notes home if they didn't complete it throughout the day, or back at the office, but the notes had to be done within 48 hours. The notes were SOAP note based. They were in SOAP note format, but they were electronic. So my supervising OT, she did say that it is nice to know the SOAP note format just so that you actually understand what you're writing for the note. They also had a really cool section in their notes that they could write between the team members. They could write, like if somebody wasn't really liking therapy, or like they had an issue with somebody. It was actually really nice, so that especially new patients, so they knew what they were walking into. My reflection of my level 1 evaluation. My supervising OT said I had great communication and I had a lot of care for her patients. She didn't really put anything that I needed to work on. But as a level 1 student, I wasn't very involved in the treatments. I did a lot more observations, if anything. But I did take a lot of the driving time and I took advantage of that to talk with my supervising OT, and I actually learned a lot from her. I will use my caring nature for people as my approach to patients. The main thing that I learned is that you need organization and time management, especially in home health. You need to make sure you're organized so that you're prepared for your patients. You don't have time to stop treatment and go get the rest of your supplies if you even have them with you. So you need to make sure you have everything that you need and have a plan before you walk through their door. You need to take advantage of any downtime that you have to prepare for the next patient or to write your notes. You don't want to be stuck writing all your notes when you get home. My feelings towards home health, I was really nervous when I first started. I was scared about being by yourself. You may not have everything that you need. What if you needed help and nobody's there? Also, you never really know what you're walking into. But I feel working in home health, I feel like I was really wrong. They worked together as a team. I felt like it was a very big team effort to help these patients. And that you just need to have a plan set aside and a couple backups before you walk through the door. We did a lot of ADLs, and we used a lot from the home to do the treatments. I very much like the flexible scheduling, and I found it very beneficial for elderly patients and those that can't travel or can't afford to travel to the facilities. I really liked home health. I think I would really like it in the future. I liked it was flexible and how they use their home to help the patients. It really helped adapt them so that they could still live at home. I don't think it would be a good facility for a new graduate because you just can only learn so much on your own. You do need to learn from other people and what to do and what not to do by seeing what they do. And also you do need closer supervision when you first graduate. This was a really good facility for a level 1 student, but sorry, I have a patient that's supposed to be a student. My supervising OT had a hard time letting me join in the treatments, but I did learn a lot from her. I just wouldn't suggest this facility for a level 2 student because I don't think they would get as much out of it as they would from other facilities. If you want to learn more about Premier Home Health, I did include the link at the bottom. Thank you.